Getting enough vitamin D is one of the easiest ways that you can improve your overall health. Not only is adequate vitamin D associated with a decrease in certain medical conditions like osteoporosis and cancer, getting enough vitamin D can actually relieve depression, increase your muscle strength, and help you to lose body fat. It shouldn't come as a shock to us then that the average person's vitamin D levels in the winter are 10 to 100% lower than they are in the summer. That's a big drop. It also helps us to understand why sometimes people struggle with more depression during the winter, more muscle weakness overall, and a general lack of feeling well. Here's a quick breakdown of a study that gives you more in-depth information as to what vitamin D is, why it's so important, and why this vitamin that acts as a hormone in the body is so important for you to get adequate levels of.
In reviewing this abstract, you get a pretty good overview of what we know about vitamin D so far. The vitamin D insufficiency affects almost 50% of the population worldwide. And it's important because emerging research is suggesting that if you have low vitamin D, you can have an increased risk for cancer, heart disease, fractures, falls, autoimmune disease, influenza, type 2 diabetes, and depression. Now, two of the most important ones I think are here are influenza, because that includes things like COVID. Potentially, we don't know completely yet, but so far we're showing some promising signs that if you have higher vitamin D levels, you have a lower chance of dying from COVID, and also majorly lifting depression. More than just a vitamin, it actually acts as a steroid hormone. A major source of vitamin D deficiency for everybody is a lack of exposure to sunlight. I think, well, I go outside, but if you are heavily covered up, like you wear a lot of hats and a lot of sleeves, or you wear sunscreen, this is saying that wearing a sunscreen with an SPF of 30 reduces vitamin D synthesis in the skin by more than 95%. Now, that's a little bit of an interesting number because we wear sunscreen to avoid getting skin cancer, and it's true that lack of sun exposure does help to prevent skin cancer, but a lack of vitamin D makes it harder for us to fight regular cancer. So how do you balance that out? The answer is that we need some exposure, but maybe not as much as we get. Also, people with naturally darker skin tone have natural sun protection, so they require at least 3 to 5 times longer exposure in the sun to get the same amount of vitamin D as a person with lighter skin tone. So if you are pasty white and thinking that's a bad thing, remember that you're at least more readily able to absorb vitamin D than somebody who has darker skin tone. We find that people who have lower vitamin D levels have a tendency to have higher body fat percentages. And as you start to get your vitamin D levels up to an optimal level, you end up increasing your likelihood of decreasing your body fat percentage. So it's pretty important. Groups most at risk for vitamin D inadequacy would be breastfed infants, older adults, people with limited sun exposure, people with dark skin, people with fat malabsorption, so if you have digestive issues, people who are obese or who have undergone gastric bypass surgery. So sources of vitamin D include sunlight exposure, things like cod liver oil, and also supplementation. Recommended dietary intakes for vitamin D. So this is interesting because if you take things like glucocorticoids, antifungals, certain medications, then you should be given at least 2 to 3 times more vitamin D, but that is something for you to talk to with your doctor about. And then we'll look at some suggestions for vitamin D intake, which would be the tolerable upper limits, which means you shouldn't necessarily go beyond these. So for infants up to 6 months, it's 1,000 IUs. 1,500 IUs for 6 months to a year, 2,500 for children age 1 to 3, 3,000 IUs for children 4 to 8 years, 4,000 for everyone over 8 years, and higher levels for people who have deficiencies. But basically, we're saying that if you're over 8, that you should be thinking about having 4,000 IUs of vitamin D daily. Some studies suggest that your body is best at synthesizing vitamin D around noon. So what does that mean? Well, a 20 to 30 minute walk outside in the sun or some kind of exposure in the clothing equivalent to about a bathing suit midday can provide an average person with enough vitamin D for the day. So if you're thinking about increasing your walks or your amount of vitamin D exposure to try and get your levels up, yes, supplementation is a great idea. Another great one is to take a walk midday and try to get as much of your skin exposed to the sun as possible. Now, if you're at work at the office, don't necessarily suggest stripping down your underpants, but there are lots of different ways for you to be able to work with this. So remember, vitamin D is extremely important, and take this information, digest it, and use it.
If you decide that supplementing with vitamin D is your best choice, then this is one of the ones that I like the most. It's a Biodemulsion Forte from Biotics Research. I think this product is absolutely great. I've tried all kinds of vitamin D products. I've tried a couple different tablets. I've tried a couple different drops. This one by far has seemed to work the best as far as helping me with my actual issues, which is feeling like I have some seasonal affective disorder during the winter. All in all, if you don't think that the health reasons are enough reason to try vitamin D, if you're having issues with losing weight or struggling with things like depression or anxiety, then you may want to really consider getting your blood work done or just starting to take some vitamin D. But remember, before you do any of this, make sure that you run this by your doctor and make sure it's the right choice for you.